right, so gave you a little agenda here. First, I'm going to go through an introduction about myself, then a little background about what is sickle cell disease, the importance of blood transfusion in sickle cell disease, diversity and barriers in blood donations, and about so I work with an organization called Sickle. So I'm going to talk about sickle cells and how can you help. So a little intro, background about myself. I was diagnosed at birth with sickle cell disease, SS. I'm going to go into later about the differences in that. As I mentioned, my first master's was in microbiology and then second in epidemiology. Currently at Sickle, I am their research coordinator. So I attend to a lot of their research initiatives around sickle cell disease. My background in research topics is patient-reported outcomes. So basically, what do the patients say about certain outcomes, whether it's a treatment or a certain drug out there for that disease, data analysis, pediatric to adult care transition, and health equity. And as I said, I live in New Jersey with my 2-year-old daughter and fiance. And a fun fact about myself is I have seen every episode learner at SVU. So I'm a true crime fan. All right, so we're going to go into a little about what is sickle cell disease. Sickle cell disease is one of the most common hereditary blood disorders globally. So sickle cell disease affects millions of people globally, and you're going to see that in the greatest number affected, those from African descent. So as you may have heard before, you may have not. So Africa has a high prevalence of malaria. And a part of that is the sickle cell trait was probably evolved to protect against malaria. Now there's always a loophole in that. When two people have a trait, you can get sickle cell disease. And I go into that into further detail. So that affects roughly 1 in every 365 African Americans in the US. And not only you see it in African Americans, there's other parts of the world that's been infected with malaria. So you can see other backgrounds affected with this disease. So this affects roughly 1 in every 16,000 Hispanic Latino Americans in the US. About 1 in 13 Black and African American babies are born with the trait in the United States alone. So I have sickle cell disease. My daughter has the sickle cell trait because my fiance does not have the disease. This disease affects Spanish-speaking regions, going back to places around the world that are affected with malaria. So that includes South America, the Caribbean, Central America. You can also see this in Saudi Arabia, India, and the Mediterranean, such as Turkey, Greece, and Italy. So going back, sickle cell is a recessive genetic disease. So that means 2 parents that carry the trait, there's a 25% chance the child had the disease. And I put a map there on the left hand. So you see the parents at top, they both have a trait. Now let's say they have 4 kids. The child that's like a blank with an outline, they don't have the disease. One with the dress with the blue fill-in, that's the child with the sickle cell disease, and the other children have the sickle cell trait. So that is what happened to me. My mother and father both had the trait. My brother and sister was born with the trait. I was the one that was born with sickle cell disease. Now there's various types of sickle cell disease. You see 4 main types. Hemoglobin SS, that's the most common, also called sickle cell anemia. Hemoglobin, so HB is hemoglobin, so hemoglobin SC. You also have hemoglobin S beta null, which is the 0, or S beta plus. And then you have more rare types you see, which is hemoglobin SD, hemoglobin SE, and hemoglobin SO. So here are some characteristics. So sickle cell disease, it affects the red blood cells, right? And those red blood cells are hemoglobin. So with the mutation in this, you see normal red blood cells, you always see them as like pictured as donuts. So that sickle cell, the person with sickle cell disease, they have this mutation where their red blood cells kind of look like a crescent moon, like a sickle shape. Because of this, they cause blockage in blood vessels. Think of blood vessels like a pipe, and you have this misshapen cell that's very sticky and pointy. It can't get through that blood vessel. And because of that, it's going to reduce delivery oxygen throughout the body. And because you're blocking something, you have like this pulsating pain. And that intense pain could be in your bones. It could cause organ damage and pain anywhere you have blood throughout your whole body. So some characteristics of sickle cell disease, you have what's called vaso-occlusive crises, VOCs. Those are when you have so much sickle cell blood stuck in those blood vessels, it causes an immense amount of pain. If you ask what that pain is like from different sickle cell patients, the way I describe it is, if you ever got your blood done, you know that tourniquet, that rubbery tourniquet they use. Imagine that tourniquet tied so tight where it's cutting off your circulation all over your body and then being stabbed with needles. Like that's how intense that pain can be. Also, you can see strokes, avascular necrosis. Avascular necrosis is when those sickle cells are blocking the bone, blood from getting to the bone. Your bones can actually die. So necrosis is death. Retinopathy, problems with your retina, chronic pain, daily chronic pain. A lot of us just go through daily chronic pain. Pregnancy complications, acute chest syndrome. That's when you're basically having that VOC, the vaso-occlusive crisis in your chest. So it can affect your heart and lungs during that time. Infections and anemia. So some of these I do go through, like I do have daily pain, vaso-occlusive crises. When that happens, you most likely have to go to the hospital to seek medical care, or sometimes it could be treated at home. I have had acute chest syndrome, avascular necrosis. So give a little background of my medical history. But my spleen was removed when I was 2 years old because the blood just got blocked in my spleen so badly it had to be removed. And that happened with my gallbladder, tonsils, and I've had avascular necrosis where that bone just dies in both hips and both shoulders. So they have to be replaced. But the big thing here in terms of blood donation is that anemia. So when your blood levels go down, basically it's due from all those sickle cell shapes in the blood and not carrying enough oxygen throughout. So why is it so important for sickle cell disease, the importance of blood transfusions? First of all, there's no standard of care for sickle cell disease. There are 4 treatments out there, but 4 FDA-approved treatments. However, there is no standard for sickle cell disease. The big thing is blood transfusions and also folic acid supplements to try to keep those red blood cells healthy. And right now, as you know, there is no cure for sickle cell disease. However, you have some patients out there that go through stem cell and bone marrow transplants. And then, so going back to the anemia, there's a key character of sickle cell disease. Some patients with sickle cell are anemic, where, they're feeling chronic fatigue. And then there's some patients like myself, I become severely anemic during those crises, those vaso-occlusive crises. So a normal hemoglobin in someone without sickle cell disease, it can be between 10 and 11 grams per deciliter, and that can be different between males and females. Females is a little lower. However, sickle cell patients, they can vary from a 6 to 11. So my baseline is 8. So imagine, if you're normal, hemoglobin is at 10 and goes down to 8, you had that chronic fatigue kick in. But for me, that's my normal hemoglobin. There's different types of transfusions for sickle cell disease. You have episodic, which means they require for pre-surgical procedures, pregnancy, and those acute pain events, those VOCs. So that is what I occurred during my pregnancy. Every month I had to get a blood transfusion to keep that hemoglobin up for my baby. Every surgery that I've had, I had to get hemoglobin because during surgery, you lose blood, the anesthesia, your hemoglobin could go down. Chronic transfusions, that lowers the presence of hemoglobin S, or hemoglobin S is what's making those curved cells, and used for stroke prevention as well. Also, for some patients with more severe anemia, they have exchange transfusions. So basically, they go in the hospital, they're hooked up to a big machine where their normal blood is being taken out, and then they're getting replaced with healthy round blood cells. So for sickle cell warriors, we call ourselves warriors. It is important to know what is your baseline hemoglobin to indicate when they need a transfusion. So again, my normal hemoglobin is around 8. Once it starts hitting 7 and 6, that's when I know it's dangerous. I need to be in the hospital. I need to get a transfusion. So going into blood donations, there are some barriers with sickle cell disease and blood donations. And also we need some diversity in blood donations. So just to give a background, there are 4 blood types of blood and 2 RH factors. So RH is the plus and minus, and the 4 blood types are AB, and O. O is a universal donor, AB is a universal receiver. So there are certain ethnicities and racial backgrounds that have more common blood types and red blood cell markers that are important in RBC typing. However, if you're chronically getting blood transfusions, such as I was getting blood transfusions as I was 2, you can develop what's called red blood cell anemization. That's a complication seen in sickle cell patients after receiving many RBC blood transfusions. Now, it could come from coming from receiving so many blood transfusions, but also because it depends on how are they typing and what antigens and markers they're seeing on the cells to match perfectly. If you get yourself tested for the sickle cell trait, and let's say you do have the trait, you can donate blood. Some people didn't know that. So a lot of African Americans that have the sickle cell trait thought they could not donate blood, but yes, you can donate blood if you have the sickle cell trait. So some blood group differences between donors and recipients. So I cited this paper because it's most commonly cited when you're talking about markers on certain cells. Here you have the type O blood is more common in African American recipients. Okay. There's also certain markers on cells, kind of like these little tags on the cell that kind of say, hey, I match with this person. So the markers CE, K, and FYA are also called Duffy. As you can see, they're less prevalent in the African American community. And these antibodies are frequently found in sickle cell disease patients. So with that being said, if these antibodies are frequently found in sickle cell patients, and this patient needs a red blood cell transfusion, they're mostly matched with someone that is African American. And going back to malaria being around the world globally, these markers have been found in the process in defense of malaria as well. According to the American Red Cross, so another tag on the red blood cell is called this U negative. It's a rare blood group seen predominantly in African Americans. So since it's very rare, it's another reason why it will help to see more African Americans get blood donations as well. So I'm going to pause here. I know it was kind of a little sciencey. Is there any questions?
Yeah, I have a question. The full types.
Sure.
The full types of sickle cell anemia, does that come from 4 different genes?
I'm sorry.
the full types of sickle cell disease,
Mhm.
are those 4 different genes as well?
Right. So it's um right. It's a different type of gene, but it's still affecting the hemoglobin. So let's say if there's two parents that have the trait. One parent has trait S, another parent has trait S. That baby is going to have SS. A different um, pair would have trait S and trait C. That child would have hemoglobin SC. Did that help a
Yeah.
little bit? All right. Any other questions?
Yeah, I think you brought up earlier that some people get like blood marrow transfusions. That's not the right word, but something like that. How do the results of that compare to blood transfusions?
Right. So the bone marrow transplant, that is a way to, you're not curing the disease because, sickle cell disease is still going to be in your genetics. However, in the blood, in the bone marrow, that's where you make your red blood cells. That's where you make the cells, white blood cells, red blood cells. That's where they're made. So if you are wiping out that bone marrow in a person with sickle cell and replacing it with someone that doesn't have sickle cell, then their bone marrow is going to say, let's make healthy cells. It's going to make healthy cells, no more making red blood cells.
So it isn't a cure, but does it temporarily alleviate the effects maybe? Or I have no idea how it would affect it.
Right. So it's a more long-term effect with that treatment. Um Stem cell and blood bone marrow transplant is a very long process and a very toxic process too, because you have to go through chemotherapy to kind of wipe out your whole immune system and blood and bone marrow. So it's a little more long term. Um, this is not saying, okay, if you have sickle cell disease in your genes, like the next day you're going to start making sickle cells. So this is more long term effect. However, the blood transfusions, this is more putting a band-aid on the problem, right? So, a person with sickle cell disease, you become anemic during a crisis, you're just putting a band-aid on the problem.
Got it. Thank you so much.
Oh, of course. Any other questions? Nope. Awesome. Okay. So going back to red blood cell immunization, that's the process of developing an antibody to a red blood cell antigen, right? So all these years in your life, you're getting all these blood transfusions. They type you as much as they can, where, they have to give the blood where in an immediate time. So they're trying to type you on many markers as you can, but there's many markers that I didn't even list. There's hundreds of them. Those are just a few. However, they're trying to type as much as you can, but let's say you're receiving blood from a different ethnicity or a background, and now you start getting different markers on your in your bloodstream. Now you're causing a more complicated system of markers on these red blood cells, and this can cause to what's called RBC immunization. You're developing antibody to RBC antigen. Now, if this happens, one of the things is it's harder to type your own blood because now you have this various array of different markers. So for me, right now, it takes about, I want to say like a day. Sometime one instance, it took 2 days for me to find an appropriate match to get a blood transfusion. But in severe cases, this can cause a hemolytic reaction. So hemolytic is when you're breaking down your own red blood cells. And again, like I mentioned, it limits the availability of compatible blood donations. This occurs around 30% of patients with sickle cell disease, and this could cause detrimental effects. So that hemolytic breakdown of red blood cells, that can be detrimental, especially during one of those vaso-occlusive crises, those VOCs. So I found this study, which I thought was interesting. Transfusions in the UK are racially mismatched. Alloimmunization rate is almost high as 76%. In that same study, I saw the alloimmunization in the Caribbean and especially Jamaica, they actually match based on rate, on race. And their alloimmunization rate is a lot lower. I believe it was about 2-3%. So there tells you, during certain matching for certain races can help a lot in order to prevent this from happening. Question? Okay. So I wanted to talk about a little about the organization I work with, the national organization Sickle. It's an advocacy nonprofit group founded in 2017 by Ashley Marcus Valentine. Our mission is to elevate the voices of the sickle cell community in our stories. We highlight a lot of disparities that we face in order to influence decision makers. And one of them is blood donations. These are some of the programs that we have. So this is an ambassador program. Anyone could be an ambassador. You don't have to have sickle cell disease to be an ambassador. If you have a friend or you learned about it, it's all about advocating for sickle cell disease. So we have different members of the community with caregivers, different clinicians to be ambassadors. And through that, we have over 200 now. We try to, with our ambassadors, we always bring their perspective or whatever your background is to sickle cell disease. We also have Faces of Sickle Cell Disease. That's our storytelling program. And you can also see this on our Instagram, Twitter, Facebook. We take the faces of our sickle cell warriors and kind of tell them the face of, basically, this is the face of sickle cell disease. This is what sickle cell looks like, and kind of spread that awareness of how we look in our diversity. And this is what I highly engage in. Our research, we try to support more equity in sickle cell disease. More research in sickle cell, it's very limited. And we also try to improve the health equity, try to make health more equal for anyone with sickle cell. So how can you help is to donate. There's always information on blood donation, especially as it relates to sickle cell. Join the Fight Against Sickle Cell Disease is from the American Red Cross, and Sickle Cell Treat Blood is another program through the American Red Cross as well. And any other questions?
One question.
Sure.
So with sick cells, you said that they're like amplifying voices and showing what the face of sickle cell disease is like. Are they also pushing for blood donation and things like that as well? And how are they doing that, I guess?
Oh yeah, awesome. So the founder was Ashley Valentine. Show back to the picture. Ashley Valentine, she this is Marcus, her brother passed away in 2020. And we always hold an organization in Illinois actually to in remembrance of him for a blood donation drive. That's one way. And in Sickle Cells as a whole, we always promote blood donations. We work with the American Red Cross and other organizations that we can promote blood donations. You can always ask us questions. A lot of the ambassadors that we have are open to discussion, and like myself. some sources in that. So we have over 200 ambassadors. However, those ambassadors all over the country. We have like Texas, Florida, New York, myself in Jersey, wherever they know what's going on in their state in terms of blood donation and blood drives, they would always tell us, and then we try to advertise that either on our social media or through our twice a month we meet for ambassador tea chats. Our tea chats are basically our ambassadors get together through virtually and we discuss what's going on in sickle cell, what's going on in the state in terms of sickle cell. And then there's ambassador priority meeting once a month. There's certain topics on that. And we discuss that as well.
Great, thanks.
I was wondering, have any like blood banks in the US started to adopt the process of hoping to match by ethnicity and by race to help prevent alloimmunization, or has that not been done in the US yet?
That's a good question. I would like to see that more often. I feel like our testing is not based so much on race, it's more molecularly, they're looking at the markers. But I was looking at the methodology in the UK. I feel like they look directly at the donor's information and they see, okay, this person was Caucasian, this person was African American, this person, so on and so forth. But that's how I would like to see it in the US, because I feel like there's we know there's a lack of diversity in donations, especially in the United States, and it will help a lot more to lower that rate of alloimmunization.
From what you've seen in working and with sick cells, I guess in your opinion, what are good ways to increase diversity in donation? If you've seen anything specific that works, or just that you think in the future could work.
Yeah, that's a good question. I really just think in sick cells, we also, our main mission is to educate and disseminate. So I like to see, as we always try to educate as much as we can, try to show what we do as an organization, try to spread the word about it, make our presence known about it. And then, like I said, thank you so much for having me here. And I see my coworker here, Corey, is joining with me too as well. So we always try to.
Sorry, I was trying to support. So sorry.
No, you're good, Corey. You're good. So we always try to get together and just educate as much as we can, and speak as much as we can about this.
Great, thanks.
Any other questions?